So welcome everyone to SIMIODE Expo 2022. And we have here Dr. Anuj Mubayi, who had a very interesting has a very interesting trajectory in his career. So he was in academics for more than 5+ years. He was in Arizona State University working with students, directing MTBI for several years. And now he is in industry. He worked in Precision here, where he was a health economist. He now calls himself as a health decision analyst, and he has more than 50 publications as of now, and more to come, while he's also working in the public health company from this January, if I know correct the facts, and he is into the real application of mathematics, which we would come to know from him in his talk. Now you can go ahead, Dr. Mubayi.
Thank you, Dr. Ghosh. Well, you have told my talk today. I was thinking of presenting my trajectory, the things that I've done and how I have done, types of projects. Well, there are a few more things that I can discuss. So let me share my screen. Can you all see my screen? Thank you, Deb. So, well, I was thinking what would be the appropriate topic to present. So today I tried to make it non-technical, but I wanted to, it's technical in some sense, but non-technical in some other sense. Technical in sense of how do you choose a research question? How do you go about working with different groups and so on and so forth, but non-technical probably in terms of mathematics. So as Aditi was saying, I'm at the infectious disease forecasting team of a public health company. I'm also part of Illinois State University, where I'm a fellow. So what I plan to do today is talk about my professional trajectory. And I think I've learned many things through my professional trajectory. And there are a few things that I enjoyed a lot throughout the pathways. So it has been a random walk. It started from India. I'm originally from India, where I did my early education, Indian Institute of Technology, Kanpur. And then I came here for further studies and graduated with PhD from Arizona State University. Then I did a postdoc at Cleveland Clinic, Ohio, in infectious disease, followed by a global health postdoc in Case Western Reserve University. And then faculty positions at Arizona State University, School of Human Evolution and Social Change. I was tenure track faculty there. And then basically I moved to industry, working for Precision HUR, which is in health economics area. Everywhere I was linked with modeling, and finally currently I'm leading an infectious modeling group, forecasting group in public health company. So this has been the path, a roller coaster in some sense, but amazing experience. I feel very lucky in that respect. And I want to talk about each one of them, to talk about what I did, how I did, and why it was so interesting. So first is my master's. It's from Indian Institute of Technology. It established in 1959. If some of you might not have known, it is actually a very unique structure. When it was established at that time, it was assisted from 9 leading institutions at that time in US, like Caltech, like MIT and Princeton, and so on and so forth. So it got direct assistance from it, both in terms of financial assistance as well as organization and leadership and management issues. So quite unique. So the educational system is very similar to what we have it in US. So that was the first exposure I got from that experience, where I did lots of pure analysis work, topology, functional analysis, and so forth, learning those courses early on. And I did one very interesting project at that time, which was sponsored by one of the largest aeronautical company called as HAL India. And there, basically, they were not having at that time technology to build fuselage of helicopters. And basically, our goal was to model the vibrations that occur through the rotor. When the rotor blades run in the helicopters, there's a vibration that get propagated through the body. And how do you model it? And how do these the places of vibration you can select? And so I used high performance computing, and I used at that time I was using a Fortran 77, Fortran 90 type of languages to model this thing. And eventually we gave the first package. It was very basic in terms of user interface, but it was very useful for them at that point of time to design. And the helicopters that they were building is now called as advanced light helicopters. So then I moved to my PhD, and in the PhD, I looked at alcohol drinking dynamics using mathematical modeling tools. And something that we uniquely modeled at that time was the contextual issues. There was lots of study on college alcohol drinking, but there wasn't contextual factors which were built into these type of models, such as these places where students spend time and mix, such as food court area, such as libraries, such as sports event, fraternity, sorority parties. I mean, there are lots of alcohol drinking study by social scientists, but they are based on demographic structure, based on social economic structures, but not from the contextual structure. And that too, how does that impact the dynamics of the alcohol drinking in the college population? So that was our goal. So we took modeling features, we imitated the models of the campus into in a computational model. But again, this was one of the model, but there was other mathematical analysis behind the scene as well. Well, this was extended to multiple addiction behaviors, to cigarette use or cigarette smoking. And we actually carried out our first survey there, social surveys, and collected the data, which is not typical for a mathematical student to design the survey and collect the data to parameterize the model. So that was the interesting feature of that work that I did in my dissertation eventually. But at the same time, I was also working in neglected tropical disease. I was working with public health department in one of the state in India. This disease called as leishmaniasis. But it's a set of one of the disease. So my last decade of research has been on neglected tropical diseases, various aspects of it, how the host come into picture. But what is the neglected tropical disease? It's basically something which has been neglected for many decades, many decades, from many different angles. Why? Because it affects the poor communities, and pharmaceutical industries are not interested in it. There's a weak infrastructure in these developing countries, and they are persisting still on that. And they causes 90% of the burden in these places, by the way, but still not much attention given to these diseases. So there's less data, and when you model it, then you realize it, how do you use that limited data for your own benefit, for modeling it. So basically, many of these neglected tropical disease are called vector-borne disease. Vector-borne means something that our insect is causing it. It could be kissing bugs, it could be mosquito, it could be sandflies. Different disease pass through the different transmission process. This is the components that are involved in the mathematical models to design some of those features. So anyway, so these are the features that we incorporate in the models and look at what are each of the mechanisms play an important role. Not all the features, depending on the research questions, we try to understand through these transmission. The next place that I was part of was Cleveland Clinic, Ohio, infectious disease department, which was my postdoc. There we looked into South African, it was almost maybe 10 years ago that we are talking about. there was a new thing that was coming to the market. It was not there in the market yet. It was called as PrEP, pre-exposure prophylaxis. It's just like a medicine that vulnerable populations for HIV takes it as a pill every day, so that this, if the infection comes, they already have a treatment and treatment can take care of it. The problem with HIV is there is a short window period after infection that people miss, usually because of social stigma or something like that. So PrEP was the purpose for it. So for example, some of the hospital workers sometimes get, by mistake, gets infection from the patients, HIV infection. For them, it is very useful and it has been given for many years. But the problem with this pill, which is kind of a vaccination in some sense, I mean, vaccination is, it is preventing you from getting infection, even though the infection get it. The problem with the PrEP is you are giving, it's made up of the same drugs as antiretroviral treatment, the treatment that is given to the patients. So if you give more drugs in the population, so PrEP, you are giving more and more people.
You get immunity.
Exactly. And you will lose the strength of the treatment that has been successfully developed over the last 60 years. And you don't want to do that. You don't want to fail your drugs. And so there is a trade-off here. What is the benefit of the PrEP by preventing the infection that you are getting versus what is the drug resistance cases, basically. So that is the trade-off we were studying, and it was supported by Bill and Melinda Gates Foundation and National Institute of Health. Amazing project. It was a massive project, first time working with clinicians. The model has gender, sexual activity levels, PrEP exposure, ART is the antiretroviral treatments, and different types of clinical aspects, which was designed. I mean, clinician wanted it, all the details in the models, but as a mathematician, you want to choose the minimal set of models so that mathematically you can analyze better. And anyway, so this was basically, the result was PrEP alone versus PrEP and ART together versus ART alone. So what causes the best benefit and how much of benefit can you quantify it? And so our platform was South African community, and because it has around 25% prevalence at that time, and now recently I'm not aware of how much is it, but definitely reduced it quite a lot. It has been very successful. PrEP has been very successful. And these results were used by WHO's from this paper that we work on. Next, we were working on global health issues at Case Western Reserve University, and I was part of a clinical trials in Papua New Guinea. And we were looking at lymphatic filariasis elimination in Papua New Guinea. It's a beautiful country, untouched. There's hardly people live there, and there's remote, there's no road, and it's amazing, full of wildlife, and amazing place to live in, although very dangerous also, because there is not much to do there. I mean, people don't get a lot of income there. So this was basically, we were modeling this thing. The goal was there's a lymphatic filariasis have been eliminated in Middle Eastern regions from many countries due to mass drug administration. In a mass, you give annual rounds of treatment to the community. But the problem with the treatment is you don't know how many years of the treatment you should run, right? So then we were brought as a modeler to decide on how many rounds of mass drug administration. This is like annual treatment level in a mass that you have to give in order to eliminate this disease from Papua New Guinea. So anyway, so that was this is called as elephantitis also. The patient looks like this, the one you are seeing on the screen. And it's elephant-like legs or extremities, hands or legs or any extremities becomes very, very, very large, because lymphatic, it impact your lymphatic systems, and the lymphatic fluids doesn't flow properly, and it get accumulated in extremities. And so, and this disease is spread by mosquitoes, by the way. So this is a Papua New Guinea look like, and this is the place we were there for 6 months. I was there helping the clinical teams with data collection, insect collection, mosquito collections, going to the field site to patient assistance. I was not doing it, but I was a part of the team and assisting it with this. And we talked about many results and practically, and this is the organization which we call it a local health department, which is called Papua New Guinea Institute of Medical Research on the right hand side. We were the goal, exactly the goal was how many rounds of mass drug administration we should do so that we can eliminate the disease from lymphatic filariasis. Next, I was faculty at Arizona State University. I was assistant professor there. And we work on a number of things, number of research grants. One of the papers that we worked, which was with my students, Bashir, and by the way, I had other collaborators also, Christopher Krebs and Marley Paredes. But this work got a very high press. And this was, I was in the faculty position, very new. And we were able to produce amazing results, and it was published in Royal Society preceding journals. Basically, the goal here was why do high school students dropping out? Bashir was a teacher in a high school before joining a PhD position, becoming a PhD student at Arizona State University. And Bashir was a teacher in Chicago Public Health School, one of the Chicago Public Health School. So we carried out social surveys in the high schools, collected the data to parameterize these mathematical models, which became one of the chapter of the dissertation of Bashir, and also publication of this this paper. BBC picked it up, and the goal here was how much is the social structure of the high school student versus parental influences is driving the dropout rate. Okay, how do you trade off between this? When is the each one dominate versus another? And it turns out that social network was key. Even though it is a short period of time that they were spending, these were very young students, 8th, 9th, we were talking 8th grade, 9th grade, we were talking about. Actually middle school and high school both, not only high school, but so we were able to quantify the impact of parental guidance versus social peer influences versus teacher influences. And BBC wrote a beautiful article on that, by the way. SIAM also picked up the news, and SIAM also wrote an article on it. Then I also worked with this big group, which was studying infection in the airplanes. And this was, airplanes were cause of infection for many diseases in the past, like SARS-CoV-1 that happens in 2005. Then it was also H1N1 that was 2009. Then Ebola in 2015, and so on and so forth. So air infection has been a key in many diseases. So we were trying to study that aspect of it. The answer, you see, air infection is very, very unique. It doesn't happen during the air travel. You have to note that. Why? Because air circulation is very good. Very, very good air circulation. So disease doesn't spread during the flight, less likely to spread during the flight. When does they spread? It is spread during the boarding and deplaning process. That is the most infection occurs, a possibility of most infection to occur. So this is what we were trying to think about. Delta Airlines, American Airlines boarding policy, Southwest Airlines, they are different. How are these boarding policies are impacting the infection level in the community? So that was the goal of that work. In that place, and we have many series of papers for different disease, different types of interactions of the people. Behavior models are also captured in it. Amazing work. We have a website called as Vipra, VIPRA, viral infection through air travel. Please go a chance to look into it. Beautiful work, still doing it, lots of work coming in. Now we are taking a camera data from CCTVs and using it in the model to parameterize the action. And it is very useful for COVID outbreak, for example. Next, I will talk about, I worked on a study called as, it was on mass shootings. And this was where our work got published in PLOS One. And this work was so much widely in the press, got into press. And this was about basically role of media in influencing and how much it is influencing of this mass event. So any mass events happens, mass shootings happens, there is lots of news comes into it. How does that impacting the next event in the future? And that was what we were modeling. And it was actually Morgan Freeman. We were in the Morgan Freeman shows through the wormhole. Some of you might have heard about that show. Very nice work, beautiful mathematical modeling, novel work, and it has made a huge impact of quantifying the media contagion process, which was the first time anyone has quantified. Our group did that work. Well, during this process, I was designing course. I did design very interesting course where I have guest speakers. I mean, it was prior to COVID, by the way. So we have guest speakers who were given from different economics, school of economics in Europe, tropical school medicine, Latin America, health departments. And we were talking about modeling of neglected tropical disease. Many of the features of this course were very unique. Traditionally, it is not captured in the coursework. So there was like an expert talks. They were doing hands-on sessions, for example. I was a teacher instructor of that course, but there was many of these things that we carried out for different diseases. Next, I think I have a few minutes, Dr. Ghosh, like 1-2 minutes or almost.
You have more than that, Dr. Mubayi. So we have almost 30 more minutes.
Oh, 30 more minutes. Okay,
Yeah.
I was rushing, sorry. Okay, so the next, I was moved to industry, but I continue to work aggressively in the research area, and I've been publishing regularly. The company that I joined was Precision HUR. The field is called as health economics. And the idea is, it's something about health and something about economics and combining it together. How do you combine it? So we look at various things. So the COVID was there, lots of problems that we started to realize in the COVID. It was making, the industry was trying to make rapid diagnosis process, because if you don't diagnose, you don't know who is infected, who's not infected. So one of the tests, which is very well known, is a PCR test, and but it takes a lot of time. It takes like 2 to 5 days. Initially, it was taking 5 days, week-long results to come back. And so the question there was, this company that we were working with, a pharmaceutical company, they have designed the rapid molecular test, rapid, which is 30 minutes long, and it's like for pregnancy that women use it just like that, very rapid. But the problem of that was it is less accurate as compared to PCR test, which is a gold standard in the field. And although it costs less, so there has to be a trade-off of the time versus effectiveness, right? So, so the question here, when we talk about health and economics, we want to capture the disease trend, but then we also want to capture the cost associated with whatever the intervention we are talking about. So for example, in this study, we were talking about diagnostic test. If you use rapid test versus if you use PCR test, the cost is different. Cost of implementing it in the populations are different. So we were trying to compare it with the PCR test, the cost of this rapid test. And we wanted to see, follow the trend of the COVID outbreak in the community. And then one time you do testing through PCR, and another time you do a testing with rapid molecular test. Which one is cost effective? So that was the idea for this one. And but remember, think about this. These rapid tests are very interesting. I mean, people will think, oh, this is very quick and we should do that. But see, if the case get missed through this rapid test, that case will think that I'm not having the disease and will go in the public and spread the secondary cases. So there is cost associated with secondary cases, and also causing harm to the control efforts in general in the community. So that issues we incorporated, the compliance issues. Sometimes the infection, because the hospitals were very overwhelmed initially. So we were requesting infected cases to stay home. So how many people stayed really home? So compliance issues are also there, if they follow guidelines or not follow. So there is also a secondary aspects associated with people who do not comply to the guidelines given by the health officials after getting tested. So there was this many issues that when you model these things, how do you take care of it and what is the cost? So again, we find the final results saying rapid molecular test is very cost effective, very cheaper than using a PCR, provided that that a PCR is taking longer than 1 day. If it is taking less than 1 day, then PCR is definitely good. There's rapid molecular test cannot take care of it. So that was a fantastic result. The quantifying the cost and the threshold behavior in this thing was a unique aspect, and was also this is work is still in the publication, is in the process of publications. Also remember, this test are used as for flu-like illness. That means it is, patient will go for testing only once they have a symptoms, right? So the symptoms could be lead to either some other disease, or could lead to COVID, or could lead to maybe influenza. So there is also a problem of multiple diseases when you are diagnosing some of these things. So anyway, so this was very interesting word, practical work, very useful work, and we end up using that one. Now I am in a public health company where I'm leading an infectious disease forecasting team. We are almost 6 people, and we aim to do fantastic work in this understanding the COVID outbreak, for example. Well, when the COVID started, there was lots of things were happening. For example, interventions were happening. For examples, the cases were increasing, the strains are changing, lots of things were changing. So our job here in this company is to understand how people build models, how we design the models. So given a starting, and COVID is a beautiful example to capture this thing. So when you look in the trajectory, you see how is the modeling evolved over a period of time and why it evolved in the way it is evolved. So we are making use of this work, and initially it was simple model, then the people realized super spreading event was happening. Therefore, they realized close contact tracing is very important. So they incorporated contact tracing work into that. Then they realized social distancing, mask use, and all those things were very important. So that's become part of the modeling thing. And then finally, they record high mortality is happening, and therefore the mortality started to come into the model very in a more structured manner. And then it was resource limited countries versus rich countries. Initially, it was only few handful of countries which were impacted, and slowly we were realizing how the models were getting sophisticated. So we aim to make a a system here so that we know where to use what type of model. By the way, initially, the two main models completely failed. For 6 months, we had a failed modeling system. For 6 months, starting January to summer of 2020, we did not, we were using models, but we were failing it. And the two models were University of Washington IHME model and Imperial College London. And IHME model was statistical time series model, and the model that Imperial College was using was an agent-based type of model, repurposed for the COVID. It was used for something else, and they were repurposing it for the COVID, and it was failing. And that was why they were failing, basically. So we try to collect those type of things in a model. These are basic idea that we focus on. For example, when we model epidemics of the disease, in the first picture on the left, you see we model as SI model, simple, susceptible, infected. It gives the trend like logistic type curve. But if we include the recovered compartment, we get a peak here. But if we add a birth and death, we get damped oscillations. Now, why I'm showing this thing? The reason I'm showing this thing is because this has a backward understanding. So nowadays, we are trying to model looking at the real outbreaks, Lear count of data, and coming backward to think about which model to use, right? And this is a beautiful pictures that guides us what models to use. Now, these are just toy examples, but this is the idea behind even the complex models that we are trying to focus on. Also, we were talking about if we could identify threshold aspects, and this tipping point is a beautiful book by Malcolm Gladwell, and there is a book, this is an old book, I think, but we wrote a paper, book chapter, Dr. Ghosh, Aditi Ghosh, who's the moderator today, and me, which is in publication right now. It's a real life example. If you would like to give it to your student to read, we would strongly advise it. You will really enjoy it. And it is along the same lines that tipping, by the way, Malcolm Gladwell was not a mathematician. He was just a beautiful writer. He used the real life examples to define what is tipping point happen, why things happen. And tipping point, for example, he was using examples of spring, what was it called? Arab Spring, for example. It was an violent, which happened as one of the small thing in Tunisia, and it is spread like a wildfire in the whole Middle Eastern countries. Why did it happen that way? There was many of these small event has happens all the time, but it becomes that big. So there is a tip off that happens due to certain things. And that is what he is talking about. We are talking in our chapter, basically from a mathematical end, in a different example. We talk about in smoking behavior, we talk about crimes in Chicago from a mathematics behavior. We talk about ecological examples. A beautiful chapter. It is supposed to come out, I don't know when, but any week, any day it can come out. It is in the publication right now. So that is what we are also focusing on, the public health company, to conceptualize it, to make it as a black box that anyone can use it for future pandemic, for example. Another aspects that we are looking into it is how do you connect scales? So one of the problems that we realized in COVID was the scale. The system was not talking to each other. There was many data sets, but they don't have this flow. And the reason they didn't have, because of different things, the infrastructure was not there. That is one thing, which as a modeler, I cannot do. But suppose the infrastructure is there, then how is these scales? One is, so what do I mean by scale? Let me talk about that first. Scale could be many different things. Scale could be size. It could be, for example, when we talk about clinical aspect inside the body, things happens inside, we give the treatment, cell interact with the treatments, and so on and so forth. virus interacts inside the body. But then there is an impact of that in a social communities, and the social community quickly impact the global community. So the data collected at a different level has a different importance. But the question here is the multi-scale problems or multi-scale analysis is a big topics in mathematical sciences. And that is what we are focusing on, using a clinical data to epidemiological data to ecological, physiological data. Interventions aspects is a human behavior aspects, which is imposed onto the natural sets of data. To satellite data, we are using satellite data, we are using telephones, we use lots of apps. So this tracks you all, all of us, and that's the data we are using to give more signal to our system to understand what is the important, when is the each one of the data sources useful in a modeling world. So where do we go from here, by the way? Well, the future is changing for modeling world. And I think we need to change as a mentor, as a student, to our students, new generation of scientists in a different way. The problems of today world, for example, I remember I teaching calculus course in my class, and I was using physics problems because those were the examples in that calculus book. Well, now there are beautiful more examples which are cutting edge to form, which is meant for today. Students feel more into those course or more into motivated if they see something in the real life and can see the importance of it in the modeling, mathematics, the courses that they are doing. So, for example, Google used to be a software company, but not anymore. It's a healthcare company now. Apple, the same thing. I mean, you may be knowing that as a software IT company, but it is not. Actually, it is mainly now becoming like a portable devices. They are using medical devices, mining symptoms. They are doing lots of things which are, have you heard of Wordly, by the way? Wordly is a Google branch of healthcare, by the way. So the reason I'm saying this thing is that, these tech company can teach us many things, the trends, and where is the new generations of scientists needs the technical skills in. So there is also recently there is a test came out for cancer surveillance and detections. It's called Galeria. It's a company called as Grail that has brought Galeria test. Why I'm talking about Galeria? It's, diagnosis is a big issue for the cancer patients, very big. It's a very painful times for patients in cancer. But then if you don't diagnose them or misdiagnose them, it's a big issues in their life. And Galeria is one of the tests that they came out, which can detect all to 50 different types of cancer. So, I mean, how good they are still, again, these are new innovations that they are talking about. But then who has studied its long-term dynamics impact in the populations? Nobody. So that's where our future project should look like as a mathematician. How do we design these future projects? How do we? There's a cell therapy that is came out, which is called CAR T. CAR T cell therapy. That's basically for cancer. It's basically train your immune system to kill the cancer cell, which has not been there before. So, so these are all new inventions in the field, and these are good modeling projects for students to work with, provided one is willing to invest time, mentors is willing to invest time and energy to learn a little bit about it. Now, social media data is becoming quite common in many respects. Of course, you need to mine some good informations for now. And how do you use in the models? I mean, we are using the social media. One of my friend says, he came to my house, he says, well, why don't you have this something like Google Siri? I mean, Google, there is something like Google, it's a voice activated many things in the house, right? So these data are getting collected in the cloud and it's being used for multiple things right now, for example, from the whole. So it is used for information, but it is also some people are using it for misinformation, which is widely available in this thing. So how do you model that misinformation as well as misinformation propagating in it? So we wrote a chapter also on a modeling, and that is talks about that thing. How do we do that? Also rare disease are very common diseases, but hardly people model this. There is a drug came out recently called Zolexma. It cost $2.1 million for one dose, and it is given at the age of 3 or 4. Before that, it has to be given. If you don't give it before 3 or 4 years, the kids will never going to get benefit out of it. But it is a very expensive drugs and very we don't know how effectively to use that thing. And why is it expensive? Can we reduce the expense of it by modeling it using mathematical models? WHO every year they talk about next decade of problems in hand, and I'm listing these 10 of them, which is these are very important current treatment problems to look from a modeling community purpose. I know I'm almost towards my end. This is the bread and butter of lots of modeling that is happening in industries in a healthcare sector. These pictures explain all the models. So if you see the y-axis is a healthcare productivity lifetime or healthcare product lifetime. So after it get discovered, any product, whether it is diagnostic test, whether it is a treatment, whether it is something else, after so horizontal axis is a product lifetime, one from the discovery to when some of the treatment become generic. That means there's no patent on it. You can reproduce for under the certain guidelines. So that's where the product life ends in some sense, because there's no benefit you are getting, industry is getting from that. Okay, so there is a 20 years patent period. So there is two curves here, which is talking about revenue to the company, and the cost is how much the company has to put in any of the product, right? So this goes, so if you see on the axis, there is from the 0, it is an early approval. If the company get approved, the product get approved by company, you start to get benefit. The company starts to get benefit, right? And the question is, every company wants to try to approve through the FDA early on. That's the goal. But they have to prove to the FDA that their drug is valuable. There's a value to the drug. I mean, value has a very specific meaning in the literature. It doesn't mean that you are causing, I mean, from medical perspective, it is beneficial. Not only that, it is cost effective also. If it is cost effective as well as it is medically effective, then you say the diagonal that we are showing is a value to the death. The value is better, right? So that's the goal. And FDA doesn't approve anything until it crosses the guidelines of a value. No matter how good they are doing. If it is, for example, Zolexma is $2.1 million, it would have not come to the market if it would have been for, let's say, the disease like cancer. It is in the market because it is for the rare diseases, which is hardly, there are hardly any number of people. For cancer, this FDA will never approve a $2.1 million drug in the market. So there are different levels of mathematical modelings that is important in this curve. There is pharmacodynamics methods. That means you are talking about how the drug is impacting with the cells, with the targeting to the affected tissue, and so on. So there is a mathematical models go hand in hand, and it is continuous process of modeling. It is not, because once you imply in the population, there's more, the drugs also changes its behavior. okay, over a period of time. So the bottom line green things is pharmacodynamics. The next layer is a clinical trial aspects where pharmacological models are very important. And then the last layer is the company's perspective. The first one is how is the green layer is models for impact of the drug. How is the drug working? Second layer is how the drug, so first layer is a drug on the target or on the cell. The second layer is on the people. How is the drug impacting? Okay, and the final layer is the yellow layer is how is the drug is profitable for company and the value it is given. So there are different layers of modeling that we do. I'm writing a SIAM article on this. It will about to come in a week's time. SIAM is Society for Industrial and Applied Mathematics. I am a regular writer in that. So it is about to come. Please check it. It is called Methodological Borrowing and Conceptual Blending. That's the title of the article. Okay, I think this is where I want to stop. I think I'm close to the time, but I have a few more slides if anyone wants interested. I hope I have not bored you all. I'm on the social media as well. I'm active on the social media. I also have a YouTube channel, so please feel free to join me at any of the podium. My website is also there. It's a fullname.com. So thank you to everyone and Dr. Ghosh for having me here.
Thank you, Dr. Mubayi. So we would like to invite questions for you, if any. So knowing your interesting trajectory, I have a question for you. So since you have been doing all this kind of work, are you still mentoring students in any form? Or if you do you publish papers with them anymore?
Yeah, well, I am right now working on maybe 20 projects different. I've maintained my student network, faculty network, and I've been working with the students, new generations of scientists also coming through my network, including that includes Dr. Ghosh as well. And I've been publishing regularly on various podium, not only in the mathematical modeling community, but also in healthcare, public health fields as well. So Google Scholar will provide you guys a good recent publication list if you are more interested in that area.
Anybody else has question?
Where is the tipping point article? I missed something somewhere. Where is the tipping point article coming out?
It's a part of a book, and it's a book chapter actually. And well, Dr. Ghosh.
Publication, yeah, it's a Springer publication for undergraduate research book, and it is still, I mean, it's still under the publication company actually. So we are waiting to hear from them for the publication date. We still know that it's under formatting and all those things. So we do not have a definite date, but once we have it, like I'll kind of email you. I'll have your email then. Yeah.
That would be great. I mean, it sounds wonderful.
Thank you, Deb.
Thank you, Deb.
Could you please tell me the name of the book?
Okay, it's like FURM, F-U-R-M. I do not remember it exactly, but it is another publication of FURM, undergraduate research. Let me pull it up. Give me a minute.
Yeah. In the meantime, actually, I can talk about some things. If you know, many of those. This is very important. I wanted to discuss, but I didn't want to keep it in the main section of my slides. You know, there are many students comes, oh wow, there's a data, you know, data scientists are needed everywhere. Should I change my field? And this question comes to me from students, and I say, okay, well, what I do in my study using dynamical systems, I use partial differential, PDs, ODs, discrete equation, delayed equations, analyze it, bifurcation analysis, stochastic processes. Those are data science aspects. Those are data science actually. And there is a field called as big data, and then there is called as a data science. And data science is a very big field. And our work as a mathematician, that a mathematical modeling work that we have been doing is part of the data science. So it is not same as a big data analysis. Big data is talking about volume, velocity in which the data is coming adaptive. So this is one point I wanted to make. It's very important for students to know that the work that we are doing in applied mathematics related to mathematical modeling, it is a need of a data science. You don't need to change the field or computer science to learn those aspects. I see there are a couple of comments, and so this is Aditi's comments. Okay. Okay.
I have a question though.
Yes.
So how would you advise a student who is who is a graduate student or undergraduate student in the mathematics department? How would you advise him about the opportunities of mathematics in industry?
Yeah, so, well, I think it depends on a student also. What is the interest? I think I have never forced a student to work on my research area. If they are interested, they are welcome to work on it. But I think I have also motivated them in their own research area. And it is very difficult for me, because suppose if someone wants to work in cancer, I don't have background in it. And I have to learn a lot more technicality into that in order to work with the students. But this is what I have been following up in my pathways, in my trajectory, to mentoring students in a way that they can shape up their motivation, their interest actually. And so in industry, well, there is many different areas that people are working for with the models. Data science scientists are needed everywhere, like in finance sector, where they are building a models, mathematical model, the same model that we teach in the class, same model in finance sector. Of course, little bit you have to learn everywhere. There's no two environment which are same. So you have to learn, for example, some statistics is key. In today's world, some statistics is key. I think all students should know it. Just like my nephew, they are very young, 10 years old. They play with, they know everything in my cell phone. But when I was growing up, there wasn't any cell phone. So well, people learn, in today's new generation, knowing computing is normal. It's like just like writing. Basically, it's must. Same way now, statistics has become very important, even though you are in a hardcore mathematical stream, and eventually at some point of time you want to go in the industry. Also, it is very important for a mathematical students, which we lagging behind in some of our students teaching, is how do they communicate? Communication is a big issue to non-technical audience. If they can explain it to the non-technical audience, they understand very well the point there. These are very key issues for any industrial problem. So in industry, you don't use heavy duty bifurcation analysis. They use very simple work, but it has to come from a good communication. It has to come from an interdisciplinary tools, not necessarily only in your areas. You should be knowing the depth in the mathematics for sure, but then statistics, computing are key apart from communication.
Thank you. Thank you, Dr. Mubayi. Do we have any other question before?
Yes. So over your several different projects, what kind of software did you use in your simulations and modeling perspectives, like the numerical aspects of it?
Yeah, so well, as I was saying in one of the project, I started using 2 decades ago, more than 2 decades ago. I started with Fortran 77, then
Right.
Fortran 90, then MATLAB, then C, C++. I used R, now using Python. Once we know one language, I think more than a software, important things is 2 things to know. There is 2 basic class in computer science. Everyone should take it, according to me. One is called data structures. Data structures are very key. And the other one is called algorithm. These are basic courses in computer science.
Sure.
Those are two key courses. And once you understand those two things, no matter what language come to you, it will be a piece of cake.
It's more or less about syntax afterwards, I guess.
Right. Everything will be syntax, exactly, which will be not different. But you have to understand what is the meaning of the data structures and what is the usefulness of each of the data structures. All that we use in our computing softwares nowadays in industry is different type of data structure, manipulating different type of data structure, massaging it that.
Sure.
Can I ask a completely different question and much less technical?
Sure.
I was very interested in your dropping out of school study because you've probably seen this, was a study done at the U of A a few years ago by the business school, looking at which U of A students dropped out from first semester to second semester to sophomore year, which is a big deal at all of the schools. And basically they were doing, it's completely different. They were looking at CAT card swipes, ID card swipes, and looking at what showed up as correlating with staying in school. And it was largely having friends. And I've done this actually example several times with students, the mid-career students, particularly the parents in the audience, look at me as though, why do they need to do a study to know this? I mean, it was very well understood. And I'm sure it's right. My question is, did you find that your study got some traction in making any universities, any high schools make a difference? I mean, the question is, what are the policy implications from what I agree is a correct result?
Well, this is a beautiful point you are making, Deb. And I think so Bashir, who was my student and was a teacher in the high school in Chicago, one of the public school, he went on to implement because he was in the school. But typically, I mean, once he left the school, they did not follow up on that. I think it requires, where I was talking about communication. As a researchers also, we have to communicate our mathematical results in a different sense. So, or maybe there is a bureaucracy involved that they don't want to. I mean, Chicago public school is very underfunded in some sense. Some
Yes.
of this, and so there are lots of constraints rather than taking a new modeling study which they don't know. They have never used the modeling work before. And also, one of the interesting part of our work is the mechanistic model, the mechanisms at what time is impacting what. It's not like every time this is the same story, but if the conditions comes in a certain way, then you will see this behavior. And if these conditions come in that way, you will see the another behavior. And that's the beauty of the work. We are talking about bifurcation reasons, basically telling, dividing the parameter space, which has parental guidance, which has peer influence, which has teacher influence as a parameter space. And we are dividing into few sections of the parameter space. And we are telling what would be the behavior in each of the sections. Okay. Is the data publicly available? Which Naima you are talking about? Which data?
Yes, I'm talking about the data which you published a paper with Bashir.
Yes, it is all there in the journal website. It is there because this is a good point. The good journal, you publish it, they would need your data to verify that part. So it is there on the journal website.
Thank you.
Thank you.
Yeah.
Thank you, Dr. Mubayi. Do we have any other thing before we conclude this session today? Yeah, it was wonderful knowing from you all these things and your diverse work experiences and such an interesting career trajectory. I would like to hear more from you in future. Much such interesting research talk. And thank you today for coming here and talking about all this interesting project.
Thank you. It was my pleasure. And thank you, Deb and everyone else. So hoping to see you all sometime in other places. So thank you.
Thank you.
Thank you very, very much.
Welcome.